STI-related vaginal discharge. So while a vaginal discharge is a notable clinical feature of an STI, not all forms of vaginal discharge are abnormal or indicative of an STI. Vaginal discharge may be associated with a physiological state such as menses or pregnancy, or with the presence or use of foreign substances and chemicals in the vagina. A careful risk assessment of women with a vaginal discharge may help identify STIs and non-STIs and selection of appropriate treatment regimen based on the most likely etiology of the vaginal discharge. So other considerations for selecting treatment include pregnancy status and patient discomfort. The causes are Neisseria gonorrhea, Chlamydia trachomatis, Trichomonas vaginalis, with green or yellow, smelly, bubbly or frothy discharge associated with itching. Also, herpes simplex virus following first episode of infection. The symptoms are vaginal discharge, change in color, odor, consistency or amount, vulvar swelling, pain on urination, low abdominal or back pain. The signs that are usually elicited are vaginal discharge, vulval swelling, vulval erythema, low abdominal tenderness, cervical excitation tenderness, and cervical mucopus or erosions on speculum examination. Investigations: high vaginal swab for microscopy, culture and sensitivity if available. Treatment: so the main treatment objectives are to identify and treat non-STI vaginitis, especially candidiasis, which is frequently diagnosed in women and being evaluated for STIs. To assess STI risk and treat STI-related infections appropriately, so to prevent complications and sequelae, and to treat both patterns simultaneously as much as possible. Non-pharmacological treatments. There is none for STI-related discharge. Pharmacological treatments. Your risk assessment. So parameters used in the risk assessment for cervicitis are partners. The patient's partner is symptomatic. That is, partner has a ritual discharge. The patient is less than 21 years old. And patient is single. Patient has more than one sexual partner. The patient has had a new sexual partner in the last 3 months. The risk assessment is said to be positive, and treatment for cervicitis is recommended if the answer to the first question is yes. That is, if the patient's partner is symptomatic, or any of the other points I mentioned is yes. So if a woman has a vaginal discharge with no positive risk factor, treat for vaginitis alone. If she has a vaginal discharge and a positive risk factor, you treat for both vaginitis and cervicitis. The treatment for trichomoniasis and bacterial vaginosis. So you give metronidazole oral 2 grams that is contraindicated during the first trimester of pregnancy, or metronidazole oral 400 milligrams 8 hourly for 5 days, which is contraindicated during the first trimester of pregnancy, or secnidazole oral 2 grams that is also contraindicated during the first trimester of pregnancy, or tinidazole oral 2 grams that is also contraindicated during the first trimester of pregnancy, or clindamycin cream 2% topical preferred in pregnancy. And for the treatment of candidiasis, you give euconazole vaginal tablets 200 milligrams inserted into vagina at night for 3 days, or clotrimazole vaginal tablets 200 milligrams inserted into the vagina at night for 3 days, and clotrimazole cream applied 12 hourly for vulval irritation. Treatment of gonorrhea: give ceftriaxone IM 250 milligrams stat, or cefizime oral 400 milligrams stat, or ciprofloxacin oral 500 milligrams stat, to avoid in pregnancy and lactating mothers. And also treatment of chlamydia: you give doxycycline oral 100 milligrams 12 hourly for 7 days to avoid in pregnant and lactating mothers, or tetracycline oral 500 milligrams 6 hourly for 7 days. Avoiding pregnant and lactating mothers. Or erythromycin oral 500 milligrams 6 hourly for 7 days, or azithromycin oral 2 grams stat. So referral criteria: you refer all cases of recurrent vaginal discharge or treatment failures to a health facility where speculum examination can be carried out and microbial culture and antimicrobial sensitivity test can be done on the vaginal discharge.